It's critical that organizations create a value management office, because when you examine the operational landscape right now, you have increased competition amongst healthcare providers. You have greater demand for services, which is a good thing, but the problem is that the patients are more informed and they're more affluent, and they're starting to ask the hard questions about, what are you going to do for me for my specific condition? And they can research you till the cows come home on the internet. And then the other thing you have is you have regulatory requirements such as bundle payments or the Affordable Care Act in the US, which is now mandating that providers that are getting CHIPs, Medicare or Medicaid, start reporting on those outcomes. So in my mind, a strategic differentiator is the value management office. It's that small cadre of people that can help you articulate your strategy, measure your success, and then find ways of fusing the information together across your organization to articulate success. Value management office, the way I think of it, is really that small cadre of subject matter experts that understand your mission, your vision, your values. They understand the deep dive on your strategies or the initiatives you're trying to achieve, and they can lead you through the process of creating critical success factors and measurable outcomes off of them. Then they can also help look across the entire landscape at the programs, the interdependencies with IT, your quality and safety folks, your financial staff, and create some really good performance measurements as well as key performance indicators that you can then track in real time if you're using a Value Explorer to be able to determine whether or not you're achieving that strategic success that you wanted to in the first place. And I think in doing that, that really creates a strategic differentiator for your healthcare organizations that others won't have. I mean, they can help you look at such things as, where's the underserved market? Where do I need to get a competitive edge? They can use things like predictive analytics and propensity modeling to also help you out in terms of figuring out where am I going to get the most bang for my buck with limited resources, right? I mean, it's no wonder that 80% of all health IT products fail, right? And part of it is because you don't understand the relationship between health IT and the outcomes you're trying to achieve, particularly in healthcare. And so one of the ways you do that is if you're looking at it from the health perspective, you focus on the patient condition and you measure what that outcome should be for that specific condition. And then you figure out the interrelationships if there is health IT involved in it or not. Value Management Office also provides 5 distinct deliverables that you're otherwise not getting within your organization. The first is that they help you define your clinical outcomes based on the specific patient condition. Secondly, they'll help you understand your costs through time-driven activity-based costing, mapped to a specific process that delivers that desired outcome. They'll also help you with your investment strategies as well as your monitoring for it and its interrelationship with delivering of a desired health outcome. It can also help you with the bundle payments and negotiating bundle payments and creating the proper fee structure for it and risk adjustments. And then lastly, they also monitor and develop the common operating picture, which then can be used for business intelligence to make informed decisions off of.